community leaders, whether it's folks in county executive office, both Howard County as well as Montgomery County. Also the CEO of Holy Cross. We'll get to the speakers, but yeah, let's go ahead and get started. First of all, let me first say thank you to the people. Let me first introduce myself, because I know this is streamed through Facebook Live. Andrew, if you want to mute the others real quick. So it's being streamed on Facebook Live, and for those who don't know me, so medical doctor, a U.S. Army veteran, Zumba instructor. I have my executive Masters of Health Administration that I got at GW, and I did my residency at Walter Reed, which is what brought me to this area. I have awarded National Defense Service Medal and an Army Superior Unit Award. I was a Chief Medical Officer in Fort Meade, and Chief Force Officer over there. So I have a passion for public health, and medicine is also, health and wellness is my passion as well. The other thing I really appreciate is the the collaboration with our community leaders to keep our communities safe and healthy. Three others that I have to mention who have helped me significantly in doing this, putting this together, I should say, is Mr. John Reid, who's our past president in our Potomac Rotary. He served a 2-year presidency, and his background is in portfolio management and private lending firm. And then Mr. Andrew Klansek, who's on here, he's the director of community relations in Brandywine Senior Living Center. And he has a 16-year background in working with seniors. He's got a lot of energy. I'm the president. I should also mention I'm the president-elect for a Rotary Club of Potomac, and he's got, if there's someone who matches my energy, it's him in our club, and so I always appreciate that. Miss Amanda Kamara is going to join, and she's my office assistant, and just I can't make it without her, and she's also a good friend. So we'll get started with our speakers. First speaker is the Montgomery County Executive, Marc Eldridge, and I really appreciate that, he's joined today because he's not feeling well, and as the whole county knows, at this point you can't keep that, right? So COVID positive. So I appreciate that he's here. He served as county executive since December 2018. He served 3 terms, which is 12 years, on the Montgomery County Council as an at-large member, first elected in 2006, and prior to that was at Tacoma Park City Council member for 19 years. He's taught in elementary schools for 17 years. As an elected official, he has been focused on an overarching vision of making Montgomery County a more equitable and inclusive and efficient place to live and work. Since becoming county executive, he's launched Early Care Initiative and appointed the first ever chief equity officer for the county. He launched the For Business Initiative, which has increased resources for small businesses, improved procurement processes, and increased contracts with local businesses. He has actively engaged the community on multiple efforts, including his comprehensive climate action plan and reimagining public safety. He has helped mitigate the pandemic impacts, providing financial support to businesses, nonprofits, and individuals, and he's a product of Montgomery County and has the highest vaccination rates in the country. And I would also, on a personal note, like to add that as soon as I asked our county executive, he responded immediately and said yes to doing this. So, he's always out there, literally till now. The last 5 days he's had to, remain at home, but he's very proactive. He's a good friend. And go ahead, county.
Thank you very much. Yeah, I confess I'm in day 7 of COVID, and I don't have a severe case. I apparently have a mild case. I had my Kaiser video appointment today. They didn't recommend anything more drastic than what I'm already doing. It's not the most fun I have, but I got to say, I've had worse flu, which is kind of what I'd expect for somebody who's vaccinated and boosted, which so I kind of fit the story they're telling about people who are vaccinated and boosted. So this has been, it's been a really difficult couple of years. We've never, ever in my life had to rely on the medical profession the way we have over this couple of years. And I have always felt that, the doctors, the nurses, all the healthcare workers have been put under enormous strain under the system, and have been, victim of, serious abuse. I mean, I never thought I'd live to see the day that people would abuse people who are trying to save people's lives. And I know for, my own doctor in the county, Dr. Travis Gales, when he was our chief health officer, he did an exemplary job. He stood up to the governor. He made decisions that were the right decisions for public health. And we still found him subjected, to hate mail and all kinds of personal attacks on him. And it was just a shame. We had a doctor signed up. We thought we'd recruited to fill that space. And when COVID ticked up again with Omicron, they walked away from it, said, I'm not prepared to subject myself to the kind of abuse that's going to come from this. And so it's really asked a lot of people. And, you put your lives on the line, which is really difficult to do. And to go in every day and deal with sick people and to deal with distances and knowing, like I know that masks aren't perfect. Masks are a good line of defense, and the better the mask, the better the defense. But very few masks are, foolproof and have, no possibility of infection. So to be in that work every day and to save lives has just been really, really important. But, your work and your voices in the community, that, having this pool of medical professionals to go to and be able to explain to the public the importance of what we're doing, and to kind of reassure people against the massive amounts of misinformation that have been put out there, that COVID is real and COVID's a problem. It's been, in my mind, without your assistance, we would not be anywhere close to where we are today. And I think in Montgomery County residents, we're a reasonably sane group of people. That's why almost everybody's vaccinated. That's why almost everybody's boosted. And now we're trying to get people, actually we're trying to get the people to get boosted. We're only about 55% boosted, but we got, 90% with 2 doses. So we're trying to get that last group through there. But people listened here. And I think that made everybody's job a little bit easier. We're going to keep doing what we need to do. We're going to follow the guidance. I think people got too comfortable in the summer for that brief week when the numbers dropped. And when people ask me now, why do you have 1,800 cases a day when last summer you had 4? And I'm like, well, when we were coming out of restriction, we had limits on number of people who could be in a building. We had strict mask mandates. Some things were closed. So we restricted human contact a lot more. And what you're seeing now is the result of having more human contact. So that's a price we're paying for being willing to allow more human contact. And history will tell us whether we went too far or not. But I'm confident, though, that we are going to get through this. There is a trajectory that this is probably on. And I know that you all are going to still be there working with us and standing with us, and anything we can do, we're more than happy to do. We provided PPE to the hospitals during COVID. We were able to, support them when they couldn't find supplies, and we're going to continue to help whoever needs assistance from us. And again, I look forward to hearing from some of you. I'm going to drop off a little while because I'm a little tired, and but I would like to hear a few people talk, and just thank you all for everything you did. I think the residents of this county know how important you've been to everybody's health here.
Thank you so much. Thank you, Marc, for coming out and speaking. I know it's hard when you're not feeling well. I've had, people present with a whole host of symptoms, and some can't get out of bed. So I really, really appreciate it. Next, we'll move on to our Howard County Executive, Mr. Calvin Ball. So Mr. Calvin Ball is the Maryland native and a resident of Columbia, where he and his wife, Shawnee, are proud parents of 2 daughters who attend Howard County Public Schools. In 2006, Ball made history when he was elected the youngest chairperson in the history of Howard County Council. He made history again in 2018 when he became the first African American to be elected as Howard County Executive. Trailblazer he is. As County Executive Ball established the mission to efficiently and effectively and respectfully serve the residents and businesses and visitors of Howard County, Maryland, his vision is to innovatively expand the opportunity and foster the best quality of life for all who work, live, and visit Howard County. In the first 3 years, he and his team have prioritized growing ready and successful students, fostering safe and engaging communities, creating a clean and sustainable environment, supporting thriving and healthy residents, building reliable and accessible infrastructure, promoting a strong and prosperous business climate, and leading an innovative and efficient government. In the past year, County Executive Ball has led through a response to COVID-19, including distributing vital funds to residents and businesses, standing up COVID-19 testing facilities, and implementing vaccine distribution plans. County Executive has also serves as the first Vice President of the Maryland Association of Counties for 2021 and 22 term. With MACO, he serves as the 6-member executive committee that oversees its fiscal, personal, and management issues. County Executive Ball is a lifetime member of the NAACP, and in 2012, he founded the Diversity Caucus of MACO, the first statewide caucus for county elected officials of color. He also participated in National Association of Counties and Gates Foundation and Economic Mobility Leadership Network to explore the roles of counties and play to positively affect economic mobility. He holds a Bachelor in Arts and Philosophy and Religion from Towson State University, a Master of Arts in Legal and Ethical Studies from the University of Baltimore, where he was nominated for the Spirit of Excellence Award, and Doctor of Education from Morgan State University. County Executive Ball, I'll let you speak.
Well, good afternoon. Thank you so much. It's always quite a pleasure to join you. It's good to see my good friend Marc over in Montgomery County. And I just want to personally and publicly thank Dr. Gowda for your efforts to organize this event and bring us all together. Throughout the past 2 years, we have commended our healthcare workers for going above and beyond to keep our community safe and to save lives. And we know that we have many healthcare heroes among us across the DMV who continually work tirelessly, even though oftentimes you are chastised, you aren't appreciated, and you're questioned. This latest COVID-19 surge caused by the variants, I know, is overwhelming. And as you all work to not only take care of us, many of you are still taking care of families and our healthcare workers, those in the front lines. I know many of you are exhausted. During this pandemic, you've been asked time and time again to step up, sacrifice your time, your energy, and your health for our community. In fact, just yesterday, you may have read that I committed $2 million to the Howard County General Hospital and $400,000 to the Howard County Health Department and American Rescue Plan funding. This $2.4 million will help address critical staffing needs at both organizations amid this surge, because I've recognized that some of you are getting burned out. And those of you who haven't, you all serve as a beacon of light, not only to our community, but frankly to your entire profession. COVID-19 has demanded agility, and our doctors have been able to provide critical care to our community while riding the ups and downs of direct and secondary trauma, of those grappling with loss from COVID-19. I have seen firsthand the effects it has had on those working tirelessly on the front lines, and I thank you. Howard County, the state, our nation and our world is so grateful to have resilient leaders like yourselves. And as more and more of our community seeks life-saving care, we cannot lose our medical professionals, our healthcare heroes, those who are leading the way and saving lives. I want to thank each and every one of you again for your hard work, your dedication, your resiliency over the last 2 years and beyond. Thank you for your hard work to keep our community safe. And I was asked recently how I feel as we are going through this current surge, these variants. And I talked about the importance of vaccine versus variant. I was glad that in Howard County we are leaders in vaccinating. I'm glad that in Howard County we're leaders in having booster shots. And while I am concerned, while I know we are all weary, I remain hopeful. I remain hopeful because I know that we will get through this, and we will get through this together because of leaders like you. Thank you again, and God bless you.
Thank you so much, County Executive Ball. That was really wonderful, a great message of resilience and hope for the future. Thank you. Much needed in this time. Next, we will go on to one of my personal favorites. He's a Potomac Rotarian. He's like, I call him our Michael Jordan in public health. He is Dr. John Severs. So Dr. John Severs, he's going to go down in the history books, and it just excites me to even talk about him. So he's a professor emeritus of pediatrics, obstetrics, and gynecology, immunology and microbiology, and tropical medicine at George Washington University, Children's National Medical Center in Washington, D.C. as well. Previously served as the chief of infectious disease research, National Institute of Neurological and Communicative Diseases and Stroke, at the National Institute of Health in Bethesda. He now serves as the Institutional Review Board of the headquarters for the U.S. Army Medical Research and Material Command, IRB, and the Advara IRB. So he received his bachelor's from the University of Chicago and in arts, and then a Bachelor of Science and Master of Sciences, MD and Ph.D. at Northwestern University. He taught medical schools at Northwestern, Georgetown, and George Washington. He's been a medical advisor and a consultant to the National Multiple Sclerosis Society, the March of Dimes, and Boy Scouts, and has published over 600 scientific articles. He has been president of several medical research societies and served on the editorial boards of several medical research journals. Now, here's the good part. Well, as if that part wasn't good, but the exciting part for any Rotarian, at least with all of this, is that as a Rotarian in 1964, he served as the Rotary, as club president, district governor, assembly instructor, a legislative council member, later committee member and chairman, a long member of the 3H and programs committee of the Rotary Foundation. Dr. Severs monitored and advised on the development of the Rotary's Polio Plus program. He was visited numerous projects to help assess the impact of Rotary support. As the vice chair of the International Polio Plus Committee, Dr. Severs not only helps to develop implementation policies, but also articulates Rotary support for global polio eradication. As a member of the United States Rotary Polio Eradication Advocacy Task Force, he has testified before U.S. Congress in support of funding for polio eradication. He also met with many senators and representatives to support the international polio immunization programs. He has represented Rotary at meetings at the World Health Organization, UNICEF, and the CDC. He is actively involved in our Rotary Club of Potomac, as well as Rotary International and the Safe Blood and HIV/AIDS in India and Africa initiatives. Dr. Severs, I'll let you take it over.
Thank you very much. I appreciate being here today and to speak briefly with you. The program I'm going to talk about relates to Rotary International, and it has been something we've been involved with for a number of years. Actually, Rotary has been a service club since the early 1900s worldwide, with now over 1.2 million members in 32,000 clubs. So it's a global organization and providing service in many ways. But let me just tell you why Rotary got involved in immunization and specifically polio immunization. In May of 1979, which is a little over 40 years ago, Rotary decided to open a new program area. We had always served local activities, local club activities of service, but we decided we would do something at an international level, working together. And at that point, some of you may remember in 1979, we had just achieved the eradication of smallpox, which was obviously a great advance. It was more than just immunizing for smallpox, but it truly was the first and only disease which has been eradicated. That is, it no longer exists, and we no longer immunize for smallpox. But beyond that, we decided among Rotary, we needed to have a special program that Rotary could contribute. And in the United States, we no longer had any polio, endemic polio, but worldwide, there was a great deal of polio, paralytic disease going on in 1979. And to do something about that, I recommended to Rotary, and Rotary accepted as its major program an effort to eradicate polio, to take the immunization program further than just immunizing children as they became certain ages, but to eradicate entire populations from having polio by immunizing mass efforts. And so we started doing that in 1979 and have continued with the program, again, with the goal of the eradication of polio worldwide, the global eradication. And it's taken a lot of effort, as you can imagine. In the early 1979, 1980s period, we were having, in some instances, over 1,000 cases of paralytic polio per year, per month, worldwide. So with over 300,000 cases a year, it was a tremendous disease and caused paralysis of primarily children, but also adults, and deaths. And so with immunization, we knew that we could bring this disease under control, and furthermore, with full nationwide immunization programs, eradicate the disease. We have been working on that since that time, and we've been joined by the World Health Organization, by UNICEF, by the U.S. Centers for Disease Control, and most recently by the Gates Foundation. Again, working together with the target of eradicating this disease, being only the second disease eradicated once we can complete this. It's, well, how have we been doing? Well, it's been going along quite well. And the immunization levels have been very high. Instead of having 150 countries with polio, we're down now to about 2 countries with wild polio, 2 paralytic, 2 countries with some polio. In fact, the latest figures for this last year coming from the World Health Organization's data show that as of January of this year, there were only 5 cases last year of paralytic polio, as opposed to those thousands of cases we used to have. We were down to 5. It's not 0 yet, but it's certainly moving in that direction. And another thing that's we're combating is, as you know, sometimes with the vaccine, there can be a reversion to the vaccine producing some paralysis. And that's been a problem. And we've been working on that. And with the Gates Foundation, they have developed a more attenuated vaccine called the novel polio type 2 vaccine, which we're introducing worldwide for the purpose of immunizing and protecting without having the risk or reducing the risk of having paralysis associated with the vaccine. So the novel polio vaccine is now being used extensively and increasingly in those countries where it's needed. So with those 2 programs, we have again reduced the acute flaccid paralysis. I get weekly reports. There's been no cases at all and no environmental cases this week. And we monitor week by week worldwide. And the reduction in the vaccine-associated cases has been tremendous. And now with the new novel vaccine, we're even making greater strides in controlling that side effect or side problem. So in brief, then, we've gone from thousands of cases of polio every year to just a few. And we plan and project with the World Health Organization, UNICEF, CDC, and Gates Foundation. We predict in 2 years, we will finally hope to achieve the complete eradication of polio. Now, once we've received that, that level of eradication, we have to then show that that is maintained for 3 more years. And then there can be a world certification of the eradication of polio. So that's our target, 2 years to the last case of polio and vaccine cases, and then 3 more years, 2006, as the target for the full eradication of polio from the world, at which we'll be all very pleased. Let me just add on the side, though we've been talking about COVID and the importance of it. Of course, in this last year, because of this worldwide problem, we have also devoted a great deal of program and effort and personnel to immunizations and testing for COVID. So it's been done in parallel with our polio program, using some of the same people and with a great deal of effort of helping with that program too. So maybe we can get together in a few more years and celebrate the final eradication of polio and hopefully the control of the current epidemic. Thank you.
Dr. Gowda, you're on mute.
Oh, you didn't get to hear me. Oh, but what I was saying is that I get so excited just listening to Dr. Severs. He's the prime example of a very smart individual coming up with an idea, partnering with Rotary, getting all the leaders in Rotary involved, then testifying in front of Congress to, ask for funding for polio and making it international. So it all started with a single individual, and that is the power of an individual working with political leaders, working with medical leaders and the international community. So it's very exciting from a public health standpoint. Next, I will introduce my very good friend, Brooke Lehrman. So she's a Maryland State Delegate of District 46 and also a candidate for Comptroller of Maryland. She's a disability and a civil rights attorney, a mother of two, and state legislature. Brooke served for 5 years as a member of the Appropriations Committee before assuming a leadership role on the Environmental and Transportation Committee in 2019. She is also the House Chair for the Joint Committee on Pensions, sits on the Joint Committee on Ending Homelessness, and founded and co-chairs the Maryland Transit Caucus. Brooke is an energetic and effective advocate for constituents and her families and small businesses. First elected in 2014 to represent Baltimore's 46th legislative district, re-elected in 2018, Brooke is now announced as the candidate for Maryland State Comptroller. And I would have to say, on a personal note, I've heard Brooke. I'm always inspired. She is a family woman. She's a community woman. She stands for righteousness. And I'm always truly, truly honored to be in her presence. And I'm truly inspired by her. Brooke, I'll let you take it from here.
Thank you so much, Dr. Gowda. It's great to be here with all of you. I was thinking about what I wanted to say today, besides thank you, thank you, thank you. And just a few days ago, sort of a cute story. I have a 9-year-old son and a 4-year-old daughter, and we were driving somewhere, and my daughter announced that she wanted a cape. And I said, "Why do you want a cape?" And she said, "Because I want to be a hero. I want to be a superhero, so I need a cape." And my son turned to look at her and said, "Haven't you read the signs everywhere? Some heroes don't wear capes." And it just made me laugh because for the past 2 years, of course, we've seen those wonderful signs all over, thanking our medical professionals, thanking all of you for the work that you do. And we live very close to Bayview and Johns Hopkins and University of Maryland Medical Center. And so my son that has become inculcated in him, and he now understands that there are heroes who look and dress very differently, and that so many of the heroes in the past 2 years have been you and have been our medical professionals. So a huge thank you to all of you. As a mom, as a legislator, as a candidate for statewide office, I wanted to join today on a Saturday afternoon to say thank you to all of you. This has obviously been an incredibly challenging couple of years, and your work is really what has allowed our state and our nation to keep moving, through your grief, through the challenges that you all have seen. You have continued to persevere. And that means so much to the rest of us, right? When we look to our medical community, our doctors, to really be leaders in our communities. I will say, I'm on several chats all the time, and my friends who are doctors or my friends who are married to doctors and saying, well, my husband said this, or my wife who's a doctor said that. And it's, we are looking to our medical professionals and to our doctors now more than ever for your work, for your expertise, and sometimes for your encouragement that we will get through this. And so I just want to say thank you. Thank you to all of you for your work. As a legislator, I'll say we have tried to listen to you and to your needs. It's great to see Jean here from MDKI and others. We have, under leaders like Delegate Pendergrass and Delegate Pena-Melnick from our Health and Government Operations Committee, Senator Pinsky on the Environmental Health and Education Committee in the Senate, and of course, Senator Clarence Lamb, my good friend, who's the only practicing doctor in the state Senate. There are many of our leaders who over the past 2 years, we have turned to and listened to you for the work that needs to be done at a legislative level, where we can step in and say, these are the laws or these are the regulations that have to happen. I actually sit on the regulatory committee called the AELR committee, and we've had more emergency regulations that we've had to approve in the past 2 years than in my previous 6 years combined, trying to make sure that we can do what the hospital association needs or what MDKI needs us to do to make it easier to hire the nurses, to hire retired doctors, to hire immigrant doctors in to help assist and make sure that we have personnel. So I just want to say thank you to all of you, your state legislature. We are behind you. We appreciate you, and we will keep doing all that we can to support you in the work that you do to help keep our community safe so that we can grow stronger through all of this. So thank you so much for having me on, and thank you for the work that you do.
Thank you so much, Brooke, for coming on and speaking. I'm always inspired by you, and you're just so authentic, and you're real, and you're honest, and I love it. Thank you. Next, we go on to one of my other personal heroes. My mentor and good friend, Dr. Norvel Coots, serves as the president and CEO of Holy Cross Health and is the president and CEO of Maryland region of Trinity Health. Holy Cross is a $600 million health system consisting of Holy Cross Hospital, Holy Cross Germantown Hospital, Holy Cross Health Network, Holy Cross Health Foundation, and Holy Cross Radiation Treatment Center, all located in Montgomery County. He currently is the chairman of the board of the Maryland Physicians Care, a Medicaid MCO, and serves on the executive committee of the Maryland Hospital Association. He's a member of the Maryland Governor's COVID-19 Task Force. This is all after retirement, mind you, because in 2016, he retired from the United States Army as a brigadier general. His final assignment was as the commanding general of Region Health Command Europe and as the command surgeon for the U.S. Army Europe and 7th Army. His previous assignments have included Deputy Commanding General of the U.S. Army Medical Command, the Assistant General of the Army, and the Surgeon General of the U.S. Forces in Afghanistan. From 2008 to 2011, he served as the final commander as the historic Walter Reed Healthcare System and Walter Reed Army Medical Center in Washington, D.C. He's a board-certified dermatologist, holds a master's degree in strategy from the Army War College, and a certification in advanced healthcare management from the Interagency Institute of Federal Healthcare Executives. His civilian healthcare awards include the Scroll of Merit of the National Medical Association, the 2020 Exceptional Healthcare Executive of the Year Award, given by the U.S.-India SME Council, recognition as one of the recipients of the 2018 Distinguished Healthcare Leadership Award from the National Association of Healthcare Sector Executives, and recognition on the 2017 and 2019 Becker Healthcare American Medical Association list of 105 physicians leaders to know. His military awards and his decorations include the Distinguished Service Medal and the Defense Superior Service Medal. He's also been awarded the Legion of Honor from France and is a member of the Order of the Military Medical Merit. He's also a member of the American Academy of Dermatology's Leadership Circle on Volunteerism. That's a mouthful to say, Dr. Coots. So I'll let you take it away. Thank you for joining today, Dr. Coots.
Yeah, no, thank you very much for the invitation to be a part of this. And I apologize. I thought my EA sent my extremely short bio. So it was only supposed to say Van Coots is a dermatologist who runs Holy Cross, and that's it. And really that's who I am. So good evening, everyone. First, Happy New Year to everyone. And let me just say, you know, as we talk about the people who have been involved in the medical and the clinical response to COVID-19. We are on week 99 here in the National Capital Region, almost 100 weeks of response. And now certainly with the surge in Omicron, our numbers are right back up to where they were in May of 2020. So it's just amazing that we have gone full circle and we're seeing such incredible numbers. You can imagine that at this point in time, those healthcare heroes that have been at this work for 2+ years now are exhausted. And we have a triple-barreled crisis going on right now, the crisis of COVID that hasn't gone away, the crisis of staffing that we've all heard so much about, and now the financial crisis as well, because healthcare systems and hospitals are being brought to their knees by not being able to afford to pay for all of this extreme travel agency staffing that has to come in and backfill all of the staff that we lost. And yet, with all of that, I mean, I think it's very important that we remain very positive. One of the things, we're tired. And so resilience becomes very important. And so we try to stress that despite all the negativity, despite all of the things that have gone on, there's still an awful lot of things to be grateful for. And when you look at your life from a position of gratitude, then that helps to rebuild resilience. And just like any other crisis that we've ever been through, this too shall pass, and we'll come out on the other side of this as well. If there's anything positive that can come out of COVID-19, I think that COVID-19 has been the big disruptor in healthcare that we've been waiting for. We thought it was going to be Berkshire Hathaway. We thought it was going to be Walmart, CVS, whatever. None of those, I mean, came through and did anything to the extent that COVID-19 has done. The first thing that it did was it exposed the lack of pandemic preparedness in the nation. The second thing that it did was it exposed the fragility of our supply chain around the world. The third thing that it did was it showed us that telehealth and telemedicine really work, because we've always been talking about where real health is in the home, and healthcare needs to be wherever a patient needs to access it, whether it's from their home, their car, the break room at work, or whatever. And COVID forced that issue, and we've been allowed to do that. And then I think one of the major things that we saw in that summer of social justice is that COVID-19 unmasked the inequity and inequality in healthcare in one of the greatest nations and one of the wealthiest nations in the world, which is therein lies some of the real pathos of the COVID-19 crisis. But then finally, this has truly been a transformational event. It has broken our health system. It has brought it to its knees, but it has given us the opportunity to pick up the pieces and to finally build a health system that we've always wanted to have, rather than simply operating the health systems that we inherited from previous generations. A friend of mine wrote a story to me the other day. He writes a kind of an inspirational email every day to his friends. He's a lifelong Disney executive and actually worked on my staff at Walter Reed after the healthcare crisis in 2007. And so he talked about having worked for Marriott originally in Dallas, Texas, when Southwest Airlines began to get its start. And that's the hub of American Airlines. And American tried to suppress Southwest Airline at every turn. So Southwest went to Love Field and opened up a decrepit field and made it their world headquarters. When the market was cornered on the ticketing programs and all of the electronics, Southwest Airlines turned to Tandy Corporation, which was the parent organization of Radio Shack, to build their system for them. So the great leader at that time was Fred Kelleher. And so at the end of this story, my friend Fred Larson said, who is going to be the Herb Kelleher of medicine? Who is going to be the Herb Kelleher of healthcare to pick up the pieces that is left over from this and create this great new health system? So I think, one of the things about being resilient is that now is the time for us to look up over the horizon and to really start to say, this is not going to last forever. COVID will eventually become endemic. It's probably on the pathway to that right now. The way the Omicron variant is acting, very similar to the flu pandemic of 100 years ago. And so now that that's happening, let's start lifting our heads. Instead of looking down, look up. Instead of looking back, we'll never be able to go back to the healthcare systems we've had. It's time to look forward and continue to move forward. So everyone, up over the horizon, let's build that great new health system of the future. God bless everyone. Thank you all so very much.
Thank you so much, and so eloquently said. That's very inspirational. That reminds me, when I was in my internship at Walter Reed, we did have during the initial days, we did have someone from Disney come and speak to us about customer service, and I was very impressed with that. And so this makes sense where that came from. So that was, I think every company should do that. It was really a brilliant idea. But next, we'll go on to Gene Ransom. Gene Ransom is such a support to physicians. He's the current CEO of MDKI, the Maryland State Medical Society. He's a lifelong resident of Queen Anne's County and former president of the County Commission. Gene was elected to the Queen Anne's County Commission on November 2002 and was the only incumbent county commissioner re-elected in 2006 election. Ransom graduated cum laude from the University of Maryland with honors in economics and the University of Baltimore School of Law. As a MDKI executive, Ransom works to implement MDKI's mission as an advocate for physicians, patients, and the public health of Maryland. MDKI is the largest physician organization in Maryland. It currently represents over 8,400 Maryland physicians. When elected at the age of 31, Gene made history as the youngest commissioner ever to serve in Queen Anne's County. During this time as commissioner, he fought to improve growth improvement and environmental policy by helping pass landmark APFO legislation and improved comprehensive plan. Gene fought for fiscal responsibility, voting for balanced budget every year in the office while reducing Queen Anne's property tax rate by over 20 cents during his time in office. Ransom plays an instrumental role in the bipartisan effort to procure the first full-service 24-hour emergency room coming to Queen Anne's County. You know, one of the reasons I invited Gene here is, for one thing, he's a great speaker. For another thing, he's really concerned about the physicians in Maryland. You know, I expressed to some question I had expressed to him when I saw him at the recent Guapi event, Diwali event, some questions that I had. And he said, you know, call me up, send me an email, and we'll talk about it, or we'll review that contract. That takes an extra amount of empathy. It takes an extra amount of care. And so, you know, one of the reasons, you know, when I spoke to him, I said, you know, how about you join this and speak to the physicians about what are the programs that MDKI offers as support, you know, if someone's reaching burnout or close to burnout. So Gene, I'll let you take it over.
Well, I think we also sent you the long bio, and I apologize for that. So I really appreciate the opportunity to be with you guys today. MDKI, the Maryland State Medical Society, has been around since 1799, and I've had the honor to be the CEO for, I guess, the last 14 years now, and I've been with the organization for 25. And I really love it. I love working for physicians. I really believe in our mission as the foremost advocate for physicians, patients, and the public health of Maryland. And we've really been tried in these last couple of years. MDKI has tried to step up and help the state without getting involved in politics. And we've helped with things like testing. We've helped with things like helping physicians with economic issues, with implementing telehealth, with all the changes that have occurred. And the one message I really want to send to each and every one of you today is, if you need help with anything that you're facing in your practice, you can reach out to us. In my mind, really, there are three big buckets. For those of you in private practice, there have been a lot of economic issues. A lot of you have really suffered because with the loss of elective surgeries and other things that have occurred on and off over the last 2 years, you might need help if you're in private practice. If you're employed, you've probably been very, very busy, but you might be stressed. And the second place where I think we can help you is with burnout. MDKI runs the physician health program. It doesn't matter whether you're a member or not. If you're having trouble with stress, anger, or an addiction issue of some kind, we'd love to help you. Many of the Maryland hospitals and every hospital in Montgomery County and Howard County participates with it. The information is peer review protected. So if you come to us with a problem or an issue, we can help you out. The Montgomery County Medical Society, which is also part of MDKI, has a unique mentoring program too, where you can get assigned and get help with a licensed counselor. So if you're dealing with those types of stress or burnout problems and you're nervous to go to your employer, who might be a hospital, your employer who might be a large physician group or a hedge fund or whoever, you can come to us and it will be private and protected and get you some help. And we want to get you help before something really bad happens. The other place where I think we can be very helpful is understanding the regulations and the rules, and they are changing so quickly. The rules and regulations around telehealth, around electronic prescribing, around all the things that are happening. Several of the speakers before me talked about all the change and innovation, and that's great, but it also means that you need to understand how you do that and how that works, and we're here for you for that. I put in the chat my email address and my personal cell. Any one of you can reach out to me with any kind of problem that you have. we really appreciate, and I personally appreciate my role advocating for physicians. I kind of feel like Alfred, who helps Batman. You guys are all the superhero, and I'm the guy in the back who makes sure that you guys get what you need. Somebody has to change the oil in the Batmobile, right? So anyway, I will keep it short so we can go on, and I'll turn it back over. But thank you so much for having me today. And thank you to those of you who are members of MDKI. I really appreciate your support.
Thank you, Jane. Thank you. That was a great analogy, by the way. I really liked it. And next, we'll move on to Dr. Naveen Goel. He's a physician and entrepreneur who serves as CEO of Loud Capital, an early stage venture capital and alternative investment firm. He first co-founded a mobile anesthesia healthcare company in 2014 that now is in multiple states and now invests in impactful companies. You know, one of my interactions with Naveen is much of his posts on LinkedIn. I'm a big fan of him. It's always inspirational. It's always grounded. You know, he posts it. Sometimes it's vulnerable things, but he really reaches out to people, and he's a true leader. Naveen, I'll let you take it over.
Thank you very much for having me. So I want to say I'm glad to be here. I know there's a lot of excitement for us being together in the public and private kind of brain trust, and a lot of people watching. So as you know, Dr. Gowda just introduced, I was in private practice for 13 years as an anesthesiologist here in Columbus, Ohio. I trained at the University of Chicago, and I was very fulfilled and very excited, and it's all I wanted to be. And very soon I started hitting some adversity and some ceilings like many people do. And culturally, I just needed to do something more. And so I started investing. I started really building and investing in different companies. One of them is Offer Health that I started and co-founded in 2014. And basically, it's a mobile anesthesia company that currently serves a big portion of Medicaid kids. And so, for example, there's, you know, I'm in Ohio right now. There's a 9 to 12 month wait to get dental extractions done for a 5-year-old kid. And so the hospital and the medical systems are so overwhelmed, and really it's not a high priority. And so they have to wait a long time. So what we did, myself and 2 other anesthesiologists, we created a mobile anesthesia company that enables the procedure in their community. And so what that does is take out logistics, it takes out time, it takes out a lot of the barriers that take a 5-year-old kid that, you know, as a parent, that would crush me to wait 12 months instead wait 1 month. And we've made partnerships with payers. I'll actually talking to payers all across the country, saving money, saving time, and a real, you know, solution to a problem. So that's what got me into entrepreneurship. No business background, just something with, you know, learning step by step. And now we employ 90 people. We're in 4 states, about to enter our 5th, and we plan on coming to all 50. So all you great folks in different states, I'd love to talk to you at some point. That empowered me as an individual to continue moving forward, and started investing formally from a fund. So raising capital from corporations and individuals and investing in impactful people doing impactful problem solving. And so what I discovered in medicine and in the entrepreneurial world is a couple of things. There's a very antiquated culture in the financial industry and in medicine in the sense of underserved communities, right? So we invest in a lot of women in underserved communities because there's not a lot of people, family and friends, who get access to investors like me. And so how can we do that better? And then my wife is a physician as well. I've been married for many years, and I can tell you, we've never talked about our different adversity in the hospital. She still practices medicine. One thing she's told me is, do you realize that when I walk into a room, sometimes they're like, where's the doctor? You must be a nurse. Can you move? I've never had to explain myself. And that's a simple thing that snowballs into much bigger things. So I just want to say that I'm extremely sensitive to that, especially because I have a wife and 2 daughters perhaps, and I want them to be empowered as much as I am. So what can I do as a physician who's left medicine? I left in 2019 to continue the impact in the entrepreneurial ecosystem and try to be a voice for all physicians and leaders. How can physicians really positively influence society outside of just the healthcare system, right? A foundation for ethical leadership. So I like to talk about it. I share vulnerability, and I really just appreciate the group here. I'll also put my contact in the chat, and I look forward to, again, public-private partnerships, solving problems for economics and sustainable solutions. So thank you very much, Dr. Gowda, for setting this up in this community.
Thank you so much. That was wonderful. I think that you know, we've had a lot of great discussions about just differences in gender and healthcare, and it really traverses a lot of fields and society that we can all work to change together, because we can be the force of change. So next, I have one of my very good friends, Dr. Gita Jayaram. She's also the district governor for District 7620, which is the DC region for this year. A past Rotary actor and recipient of 2005 and 2006 Rotary grant for the university teachers. She's a professor in psychiatry at Johns Hopkins School of Medicine, Public Health, and Nursing. In 1997, while the Rotary clubs of Columbia and Howard West, Dr. Jayaram founded the Manasi Clinic in Mangalore, Karnataka, India. She's volunteered for the National Immunization Days for eradicating polio in India several times. She started 2 Rotaract clubs, and her current Rotary Club of Howard West increased membership in the Rotary, taught as a facilitator for many Rotary Leadership Institute, and lectured at many Rotary district conferences and zone institutes throughout North America, Asia, and Europe. She has procured at least 20 grants for domestic and international Rotary work, amounting to several $1 million since 2002. And I would just like to say I'm personally honored that Dr. Jayaram is here. She's a good friend, and I can always call her for an advice for anything Rotary related, medicine related. So you'll see why she's such a delight. Take it over, Dr. Jayaram.
Thank you, Pallavi. How many of you on this screen are Rotarians? Raise your hands. I'm glad to see that you are a Rotarian too. So there are a few reasons why I'm here today. These are unprecedented times. Clearly, you have heard people talk about courage, about change, about constancy, about partnerships, and about health inequity. I'm speaking here today as Rotary District Governor. Pallavi hasn't mentioned any of my professional work, and that's not why I'm here today. How are we going to make a difference? Yes, we've got to have the courage to see how we can change the systems we're working in. 2 things emerged during the last 3 years that really opened our eyes to the extraordinary differences we have in access to healthcare for women, for the poor, for minorities, and for those who have been sorely neglected for decades, not just now, but for decades. So my work in Rotary has been similar to what Naveen mentioned, is to figure out a low-cost model of healthcare that accesses the poorest to the poor. I have worked with the poor for over 30 years in inner city Baltimore, and the problems that we see for healthcare access are no different in the poor regions of Kenya, of India, of Cambodia, and inner city Baltimore, as well as Tennessee and, West Virginia and Kentucky. The issues are the same. In this particular country, 2 things have happened in the last 3 years. The people who have money have been able to get the care they need by hook or by crook, and the people who cannot have access to money or have no idea about what is good health care or have no transportation or the ability to really reach the portals of care suffer greatly. They have died at 11.5 times the rate of people with money. So how does Rotary play a role in this entire scenario? And I'll tell you why in a minute. Number 1, we Rotarians are committed to bringing care to the poorest of the poor. Number 2, we're all volunteers. Nobody pays us for what we do. Number 3, as John Sever said, and the man is extraordinarily modest, but I will tell you, he has been the key to almost eradicating polio, which countries haven't done, ministers haven't done, UN did not do, and something like the United States of America hasn't done. Rotary is near that close to actually getting rid of polio. Now that is a remarkable achievement. And if any one of you on this panel, on this little tile panel, is not a Rotarian, I want you to contact me so I can make you one. And I'll tell you why. So we join hands with people across the world. We join hands with people across districts. We join hands with men and women, but particularly the women, 70% of whom have been working on the front lines of healthcare and suffered greatly, have shown a remarkable tenacity to not only manage their homes, their practices, their children, and work with people in partnership in the community, particularly through Rotary. So I want you to understand that. Rotary has gone where no one else has gone. If you saw a couple of videos of our caseworkers who have climbed the mountains, literally in the Himalayas, to go and give the vaccine to some poor person living on the mountainside, somewhere in a tiny hut, trust me, you too will be inspired to do more. So we raise funds, we join hands, we create partnerships. I am part of a worldwide network of a Rotary Fellowship of Doctors. We work together for every possible disease. So those of you who are physicians who want to see a different aspect of how you render care at a low cost and with great spirit, tenacity, persistence, and fortitude, join Rotary, because I will show you how. I've done it in 4 continents. What I have done through a low-cost model where we train local people to deliver the care who are able to be tutored and monitored and mentored and educated, where people approach them readily instead of waiting to go to some tertiary care model where there is a specialist with a Ph.D. or MD to reach out. Once you do that, you will see how much Rotary can do. So what we have done is reach populations that amount to millions of people with models that I created at Hopkins, that I then duplicated across 4 continents. We've been able to do it because Rotarians join hands in this great spirit of doing good in the world with an extraordinary spirit of giving to others, to making sure that the world is a better place, particularly during times such as this. So my message to you is, I can tell you a whole lot more, but I will stop here because I believe in the goodwill, the peace building, and the extraordinary work of Rotarians across the world. And you all, those of you with the fortitude and the spirit you've shown already by being here today, you are the heart and soul of Rotary if you join us. Thank you very much.
Thank you so much, Dr. Jayaram. That was really inspirational. And definitely, I think everyone is going to contact you regarding joining the Rotary. And they're welcome to contact me as well as president-elect for the Rotary Club of Potomac. But I truly believe in everything that you said. And we have Dr. Severs here, who's a prime example, and you yourself, who has started with grassroots efforts and really moved mountains to improve humanity. So thank you for those inspirational words. Next, we'll move on to Mr. Abhi Kaushik. He's the co-founder and CEO of Asta Adult Medical Daycare, a premier daycare for the elderly in Silver Spring, Maryland. He's an entrepreneur that is driven by business that benefits society. Abhi started his career in finance with a focus in renewable energy. He's a graduate from Oxford University and loves good adventure and friends and family. I will also, before I let Abhi speak, I will also say if anyone wants to put their contact information in the chat group, please do. We'll save those, and anyone who wants to reach out to the speakers can connect with me as well. Mr. Kaushik, I'll let you take over.
Thanks so much, Dr. Gowda. And I'd just like to say it's such an honor to be in the same room as so many dignitary and accomplished people. So thanks again for having me on. You know, there's a lot of things I could talk about, but I'd like to discuss a little bit about the medical daycare that Dr. Gowda had mentioned. So Asta Adult Medical Daycare is essentially a non-residential center for elderly people. So we take care of elderly people during the day. We provide them various physical, cognitive, social activities to do to keep their mind and body sharp as they are aging. And we provide meals for them. We provide transportation. We provide regular medical monitoring, and we interact, or our nurse interacts with their primary care physicians in order to catch any type of health conditions, serious health conditions before they become even more serious. So this center, we had originally just started as a medical daycare, but it has really evolved into much more than that. During the time when the pandemic initially hit in March of 2020, we were looking for ways in which we could utilize this center that we have, which is over 12,500 square feet, and what can we do during the pandemic that can add value to the community and the particular situation that we're in. So we actually were able to convert part of our center into a COVID testing center. And during that time, we did over 18,000 COVID tests at our center, and also provided food distribution, over 1.5 million pounds of food through our local partners. So we are really much more than a medical daycare. We're looking for ways in which we could contribute to the immediate needs of our community. Again, we are located in Silver Spring, and our next project that we're currently working on with Dr. Gowda and some other community partners like American Diversity Group is to start health clinics for low income and uninsured people at our center. And we cannot do this without the help of the physicians in our community, and specifically physicians who are willing to volunteer their time in the evenings after their work. This type of health clinic would not be possible without that. So I just would like to call on all the physicians who are on this call. If you are able to make a few hours a week of commitment to come on to volunteer your time for the health clinics we'd be doing, that would be wonderful. And Dr. Gowda and I, we can both talk to you more about that. So just wanted to put in that little thing in there, and feel free to contact me. I'm going to put in my contact information, my email address, as well as my phone number. And if anyone's interested, please do let me know. Thank you.
Wonderful. Thank you so much, Abhi. I appreciate that. Do we have Mr. Meyer Modi on the phone? On the, not the phone, but the call? He might not be here. And if he's not, that's okay. I don't see him. No problem. So let us move on to our next speaker. And give me one moment here. So to change gears a little bit, we next have Miss Savita Gilbert. She's the CEO and owner of Inner Belief, and she's a good friend of mine. She was very supportive when I went through a difficult period in my own life, and so I'm always grateful for her support. Her motto: there's a flower for every personality, a season for every mood, and a landscape for every vision. She's the founder and chief designer of Inner Belief Clothing and is a longtime resident of the DC metro area. Inner Belief is a family-owned business founded in 2020 by Savita along with her husband and co-founder Marc Gilbert. Inner Belief features a collection of ready-to-wear clothing for women using nature-inspired themes. Savita's artistic journey began as a watercolor artist with a passion for dressing and design. Self-taught in the arts, her watercolor paintings quickly gained recognition. Prior to founding Inner Belief as a woman legal executive at a company in DC metro area, she found herself restricted by local fashions for professional women, decided to be an agent for change, and she blended two forms of art by combining her watercolor painting and dress designing talent. She's recently featured in the DC Spotlight newspaper. I'm going to let her speak for just a few moments. I know that we've gone for a very long time with speakers. I appreciate everybody's patience, and I'll let her take over. Ms. Savita Gilbert.
Hi, everyone, and thank you so much to Dr. Pallavi Gowda for this wonderful opportunity to be in front of these esteemed doctors. And thank you so much for all that you've done during the pandemic, which is unprecedented. Without you all, it would be so hard. And thank you to our county executives, Marc Erlich and also Calvin Ball, to all of you. Appreciate everything. So, without further ado, my artistic, two things that got us through the pandemic. One was the doctors. The other, really, the thing that kept me mentally healthy was art. And turning these, without further ado, just the fun part, I want to show you some of it. Thank you, Palu, for already, sharing some things about this journey. So all of this, watercolor art into clothing, and is something that we continue to do. And one of the things I'd like to say here is anyone who purchases from this group anytime over the weekend, 10% of whatever is sold, those proceeds go to the Potomac Club, the Rotary Club of Potomac, which, as you know, supports charities. So our website is www.innerbelief.com. We'll post it in the chat. If you have any questions, my personal information will also be posted in the chat. And finally, I just want to say that we will be at DC Fashion Week. I never knew this journey would take off the way it has, but it has. And so join us at DC Fashion Week, February 26th. We'll debut our next collection. And to anyone else who's an artist out there, please continue on your journey. And I really, again, want to thank all of you for all that you've done, during this time in the pandemic. And thank you, Dr. Pallavi Gowda. All right.
You're welcome. Thank you so much, Savita, for talking and for sharing your art. So, you're a lawyer, and then you enjoy painting, and now you design dresses and clothing. That's amazing. That's quite a journey there. And I appreciate you supporting the Rotary Club of Potomac and the charities component. What, in terms of charities and what we do locally, we go to St. Martin's Pantry. We support Nourish Now, and we also support the Montgomery County Coalition for the Homeless, the American Red Cross, Youth and Peace in Action, and the high schools, so Winston Churchill High School. And we support EduGirls, which is an organization based in India that helps educate little girls in slums. And so, we know the owner of that. Well, not the owner, but she's a board member, a very close friend of mine. So, I get to hear about the benefits of what our charity dollars go to. She's very responsible and accountable and lets us know, so much appreciated. Anything that's donated to our charities, 100% goes to the charities. It doesn't go to our pockets, or it doesn't go to even our club. So it goes to the charities. We raise our own money for administrative funds. So I just wanted to